Oh, not yet.
Not yet, not yet. Okay.
Hi, everyone. Good morning. My name is Gladys Misrahi. I'm Commissioner of the City of Aventura, and I would like to welcome today Dr. Kaswan and Rochelle Ming, Director of the ER. They're kindly giving us their time and sharing with us how are you guys doing with all the reporting and the rising of cases of COVID-19. Everybody is a little scared. People are not sure what to do and what not to do. So please introduce yourself, give us a little background, and the floor is all yours. For anybody that has any questions, there is a chat below. Please send us your questions.
Hi, everyone. Well, thank you for having us. I'm Dr. Daniel Kaswan. I'm an infectious disease practitioner doctor here at Aventura. I also chair the Infection Control Committee. And we're here to give a little bit of an update and see how we're doing at Aventura Hospital. But let me start a little bit with the coronavirus. Probably most of you already know about it in more or less detail, but viral infection that it started in China late December, and we've been dealing with it here since March. It's transmitted basically by respiratory droplets. So it is from person to person. And the best way of preventing it, especially now that we're seeing all these cases going up, is by practicing what we've heard over and over in the news and in different outlets, which is, safe distancing of more than 6 feet from one person to the other, wearing the mask, and frequent hand washing. And hand washing can be soap and water for 20 seconds, or if you have any of these, alcohol-based ones, they're very effective as well. There is also the possibility that if some of these secretions drop in your hands and you take them to your area close to your airway or the breathing areas, that's how it gets in. It doesn't go into the skin. It's all via the airways. So it's not because you touch something, it's the touching and then bringing it up into your mouth or your nose area. And that's how we get it in. Once you have the infection, if you have it, most people will have a mild to moderate, but for those who start having worsening cough, fever, and especially if they start feeling a short of breath, they should not wait. They should come to the emergency room so we can evaluate them and then decide if they need anything else or not in terms of interventions. We've been prepared for this from the early on when we had committees and the guidance from the East Florida Division for HCA, which is a big corporation, and had a good amount of support in terms of how we prepared and what are the structures that we need to put in place. And that's been in place now for months, where we separate the areas where people are under investigation, or if they're positive, from the patients that are having any other medical illness that they need to also come in and we take care of them. In terms of the ER, I think we can have more of a discussion by Rochelle about what's happening in the ER, but that's just to give you an overview of what's happening right now and what's a little bit about coronavirus. We are seeing an increase in numbers, and yes, there are more people that are younger age. Now it's been reported in the news, and we've been also, having a little more of a tools that we can use in the treatment for those. But I think the message is that, don't wait if you need to come to the emergency room for what could be coronavirus or not coronavirus, because, it's your health.
Let me ask you something. A lot of people have asked, when do we go to the ER? How do we know when do we go there?
If you're older and you have, comorbidities, hypertension, diabetes, and you start having fever, cough, I think you should come to the emergency room, because, we would measure, how is your oxygenation? We can take an x-ray, we can do some blood testing and see if you are in a situation where you could be needing more support. And if we determine that you don't, then, we can say, okay, go home, continue to wait and monitor, and if there's any worsening, come back. But if you wait too long and you come where you're too sick, then it gets a little more difficult in terms of what we can do. If some people have their oxygen little monitoring at home, if they do that and you see your number coming down, or if it's reached at 93% or lower, then you should come in. But that's a general guidelines in terms of when you should come. The younger people tend to maybe have more milder illness, but they shouldn't wait if they're beginning to feel that their chest is getting tight, or that they're having significant fever that doesn't go away. They should come to be evaluated.
Hi, good morning. My name is Rochelle Ming. I'm the ED director at Aventura. I've been here for 3 years. As far as our preparation for ER, this has been ongoing. Even with our decline in COVID cases over the last 3 weeks, we still maintain diligence in making sure that our employees are safe and our patients are safe. Currently, what we do is that we have screening at the entrance to determine if we have regular medical patients, that they will go to a separate part of the ER, and then we have our COVID patients to one area to make sure that we're not cross-contaminating. We have been seeing an increase in our COVID numbers in the last week, so we just want to make sure to reemphasize as to what Dr. Kaswan said: social distancing, making sure that we're washing our hands, making sure that we're wearing a mask. However, we do emphasize that if you are showing signs and symptoms and not being able to manage it on your own, please do come to the ER and not wait for too long. As far as PPE for the staff, our staff we're fully equipped with PPE, and we also make sure that our patients have a mask the minute that they enter the building, whether they're medical or going into our COVID area. So we're making sure that as the changes come along, we are ahead of the changes or in line with the changes, but it's continuously changing.
And you still have beds available, space is okay for now?
Yes, we do. Yes, we do.
Okay, I have a question. Would you say wearing a mask, washing hands constantly keeps us safe? Stores and outdoor dining is now open. Are we safe wearing masks and washing hands?
I think that the general guidance is distance and mask. I mean, you have to keep in mind that the mask protects. You need the two ways: the mask for the other person and your mask. Your mask is not protecting you as much as the other person wearing the mask, because the mask function is it's going to stop the secretions. If I'm having anything and I'm breathing, coughing, sneezing, then the mask will stop it. So if you have a mask, but I don't have the mask and I'm close to you, your mask is not as protected as if the person who's sick has the mask. So just wearing a mask and being out there without any, caring, it's not right and it's not good. I think that everybody should wear the mask. At this point, as numbers are going high, I think that people who are high risk or old or elderly should be, very careful. Would advise to, stay at home more. And if you're going to be out, very open spaces where you're not close to people. Restaurants, I'll be a little more careful at this time that we're seeing this peak going up, because then it gets a little more, concerning when you're into close spaces. Washing hands is always very important. If you go out and you went out to do grocery shopping stuff, yes, wash your hands, because then again, the hands then touch the face, and then that's how you may, transmit it if the hands were touching something that was kind of, it's less common, but it's very important also. So I think strict washing of your hands, wearing your mask, and then distance. I think those work, but everybody has to be doing it.
Right.
So if you're the only one wearing a mask in a place where 50 people are next to each other, then that's not going to be the help. So you have to be, worry about where you are and who is around, more than just because I have a mask, I'm safe.
That's the problem with a lot of the people that are not wearing masks right now.
And
That it has to be a combined effort in order to help us. What about children? If they are washing their hands constantly and keeping masks, will there be okay?
Well, it's not, this is not about saying, you do this and you are safe. I mean, there's a virus spreading, it's in the community. We're having an increased numbers, in many states and now in Florida. So, there's no one thing that is going to be 100%. I cannot say, you know, do this and you're going to be, we're just trying to, you know, give recommendations or guidance for things that will decrease your chances of it. So, you know, those things in general, kids or no kids, are going to be the same guidance that you're hearing over and over from the CDC and the states and the city, just, you know, spreading that out. I mean, kids have been, you know, in the less severe side of illness, thank God. The majority of them will have mild disease, but there's some that could get, you know, some also complications. So remember, this is still only like 4 or 6 months into this process that we've had throughout the world. So there's a lot that we're learning on the go and more that we'll learn moving forward. So I think, you know, you have to practice this general guidance for everybody, but none of them are 100% proof, you know, other than just, you know, if you really stay at home, and everybody else is doing that, which is hard. We understand that. I think people are understanding that situation, but we want to make sure that, again, that if you're having any symptom and you're a little concerned, that you can come into the hospital so we can, you know, evaluate and take care of you if you need to. I think that's what we want to convey here more, that, you know, hospitals are being prepared, and we want people not to wait if they're really getting sick. And then if you are having something that is not necessarily related to coronavirus, you're having chest pain or something, those things are also not good to be waiting at home and just, you know, not being addressed. You know, those need to come in. They will be in a separate area and they will be taken care of also as well.
Thank you. That's really important because we all need to be aware of that. I have another question. Is it true that wearing masks for a prolonged period of time releases carbon monoxide?
No, carbon monoxide. No.
Not
You expire carbon dioxide. Carbon monoxide is not in any way, shape, or form exhaled.
Yeah.
So that's what they're saying. The mask, to be honest with yourself, quarantining at home is the safest because you don't have to wear a mask at home. But to be honest with you, social distancing, the mask does help. To what Dr. Kaswan says, you're protecting the other individual from yourself, but you also need to protect yourself. That's where the N95 comes in. However, you have to be fit for an N95 for it to work. We see people wearing N95s and thinking that they're protected. You have to make sure that you are actually fitted for an N95. So there are many different things, but carbon monoxide is not one of them.
So why are the people so hesitant towards wearing masks?
It's uncomfortable.
Like, we have educated the people. Now it's mandatory in Dade County, and Aventura has a mandatory to wear masks, and people are still hesitant. I understand that when you're walking and there's no one next to you, that you can take it off, keeping social distance and everything. But there are some people that are still hesitant, that I've heard this, that you're breathing in the sickness and you're getting more sick. So that's one of the reasons that they're telling us that they don't want to wear masks.
No.
You know, there's a lot of things that are being in social media, and I think that's been one of the difficulties in here, that there's many things that are not supported by science that are out there, and people hear it and then take it as real. I think what you hear from the major guidance organizations and our, you know, cities and Department of Health is what we know and what is scientifically proven from the Infectious Disease Society of America, from the National Institute of Health. I mean, all these places have a robust science that they're trying to base their decisions and their recommendations. So I think a lot of what you hear there, and it's not supported by any of these ones, it's not, you know, true. And I think, you know, if everybody's saying wear a mask and that's protected you and stuff, you know, people should follow. But, you know, every individual will make their own decisions. But I think the science for that is out there already.
How do we approach the young people that they think they are invincible? They're the ones that are getting sick right now. There's the ones that don't think they're going to get sick, but it's not only about them, because if they get sick, they also have parents and grandparents that can be infected, and they are the ones that are gonna suffer more. So in your opinion, how do we reach out to them?
Unfortunately, with there are many different competing media, right? So to your point, the hesitation, everybody will justify a reason as to not to do something. And unfortunately, that's what we're seeing right now. Oh, we're not going to wear the mask. We don't need to social distance. This is not real. And this is the same population that actually did not think that COVID was an issue. They still maintained, they went partying. We saw many pictures of all of that. And now we're seeing the actions of that it is real and it is here. And we needed to maintain social distancing, wear a mask, because now that's why we're seeing the increase in the younger population, because it didn't adhere to the guidance that was actually issued before. So I guess with the resurgence and the fact that it's in higher in our younger population, this pretty much shows the need for masking, hand washing, and social distancing.
I have a question from Facebook. Is Aventura Hospital accepting any international patients for elective procedures?
That I'm not aware of.
I don't remember anything that it says no. I mean, I think the elective procedures are ongoing so far until they get any guidance that they're going to be suspended, and that will be applied for, I think, national, or I mean, I don't know if there's any international, specific,
Right.
Guidance.
But to that question, every elective procedure has to have a COVID screen done outpatient up to 2 days before the procedure. So whether they're international or local, every elective procedure has a COVID, it's a requirement for a COVID testing up to 48 hours prior to the procedure.
But some of the testing, you won't know until 2 to 7 days if you're positive or negative. So if you're saying 48 hours, aren't you taking a big risk?
No, those are the hospital is doing those tests.
Right.
So it's not the patient going out and doing the test. If somebody's scheduled for a surgery here, they will come in, and part of the pre-surgical screening will require a testing done here that will usually have results within 24 hours.
Perfect. There's another question that some of the countries require, and they're being very strict on keeping 14 days of self-quarantine. Here, we have nothing. And I've heard from a lot of the residents that now with vacations coming up and summer coming up, especially Florida never closed its borders. So a lot of people are worried from people coming in from Latin America, especially from Brazil, and there is no guidelines on self-quarantine. What can you do about that?
That's a government decision.
Yeah, we can't.
We have no control on those decisions and what they, make.
But that will help with controlling the virus, right?
It's already in here. It's community spread.
Right.
So, you can close the borders if you want, but it's already spreading here at a fast rate. We went from a positivity rate of 4% to over 10% without having traveled from anywhere. So we can discuss about the borders, but it's already here and it's spreading within our community. So, we have to address what is happening now and not think about, what would be, across the border at this point.
Right.
Got it.
I mean, if we had no cases here and we were like at the 0 point, then you are more aggressive with closing or trying to monitor. But it's already community spread in throughout all the counties. So it's not about who's going to be traveling in or not.
And the countries that did implement the travel ban did that months ago. So
No, correct. Any other questions? Anything else you want to say to the people that are listening through Facebook? Any recommendations besides what we already know?
Well, I would reemphasize. I mean, I think we have to repeat it to the young people also, as parents, as grandparents, as brothers, sisters, schools, everybody, to reemphasize that there are certain measures that do have an impact. and we should try to implement and follow those to try to see if we can, keep this under a situation where hospitals can take care of people, and hopefully we don't reach a situation like we've seen in New York. But the numbers now are increasing, and we could face that possibility. So the more we act right now, the more impact we're going to see in the next couple of weeks. Remember, some of the things that are happening now, in terms of transmission or severity of illness, can manifest 1 or 2 or 3 weeks later. So it's sometimes early to see, and when you start losing about less severity or more severity, I mean, we have to wait, and then you will see how this plays out. But anything that we do right now actually impacts 2 weeks later. So we can start making those actions and those decisions and change our behavior now. It's going to impact. So I think that we just need to reinforce it and keep delivering the same message to people, so then they can keep safe for themselves. And if they don't want for themselves, at least for the people around them, for their parents or their grandparents.
I have another question. The patients that you have seen at Aventura Hospital, have they had mostly mild symptoms?
They range.
It's a range. It's a range of illness. So then some people have more milder. I mean, by definition, anybody who ended up being admitted, it's already past that mild stage. But from the ones that we've seen, as I said before, sometimes it's early because the illness can be changing as the days go by. But in the younger population, it's been a little less severe for now, but there are cases that have very critical sometimes at a younger age. So it's still, I think, as she said before, it's a situation that it's flowing. So we'll learn more about this younger group as we go by in the next week or two.
With this week, schools have been communicating that they will open starting mid-August. How worried are you with that part?
Again, if we are to go into the recommendations right now, it could greatly impact August. So we really don't know, which is the masking, social distancing, strict hand washing, limit travel going out if you can. That could greatly impact August both ways. It could make the school opening possible, versus if we do not follow any of those guidelines, it could also make opening school impossible. So this is pretty much, if we do everything we're supposed to do right now, then we will know the impact eventually, because we're learning as we're going along. So we can't really speak to what will happen in August right now, if that is a good idea or a bad idea. It all depends on how we react to it now.
Have you seen any of the drugs that have...
What? It's what?
Hello? If you have any questions, can you please put them on the chat or raise your hand, and I will totally unmute you so you can ask anything. Any other questions from anyone? I guess that everybody has asked what they needed. I really appreciate you being here and answering everything. I hope that you continue to have a lot of space and that we don't get full up, and that we can approach all the young people to let them know that this is something serious and we really need to take care of it. So with that, thank you so much.
Thank you for having us.
Thank you for having us.
Thank you, everyone, and stay tuned for next week's meeting on Wednesday at 11 o'clock.